Good morning, everyone. We're here to give an update on COVID-19. I'm joined virtually by Patrick Allen, Director of the Oregon Health Authority, Dr. Dean Seidlinger, our state epidemiologist, and Dr. Luis Davillon, a pulmonary critical care physician with Summit Health and staff physician with the ICU at St. Charles Hospital in Bend. Dr. Davillon is also a member of my medical advisory panel. I wanted to start out today with a message of gratitude to the many Oregonians who've stepped up to get vaccinated. We are now over 66% of Oregonians statewide with a first dose, just shy of our 70% goal. For our reporters who enjoy the math on this, that's just 127,000 people away from 70%. Thanks to all of you, we are getting very close to fully reopening our economy and moving out of this chapter of the pandemic. And thanks in large part to vaccinations, we've seen a sharp decline in our case counts and hospitalizations. That's also really great news. Every day we learn more about how effective these vaccines are in protecting against COVID-19. It's really remarkable. I've said when the state reaches 70% of adults vaccinated, we will fully reopen. Today, I wanted to outline exactly what that looks like for you. What does fully reopen mean? First of all, no more capacity limits for businesses. Masks will largely no longer be required by the state, with the exception of places the federal government has outlined are still necessary, such as airports, public transit, and healthcare settings. No more physical distancing. By and large, this means we will be able to return to the activities and traditions we have missed for more than a year. 4th of July barbecues, eating popcorn in a movie theater again, getting a beer after work at the local brewery with your friends. Restaurants and bars will be able to welcome a full house. The Pendleton Roundup? Yes, that too. I expect, too, that K through 12 schools will return to full-time in-person instruction in the fall, and that childcare settings will be able to meet the needs of Oregon's families. Because children are largely not eligible for vaccination yet, there may be some health and safety measures that need to stay in place in these types of educational settings. But again, Oregon's primary mode of instruction will be in the classroom 5 days a week in the fall. At the state level, we will be shifting our focus from an emergency response to pandemic recovery. Moving forward, we will support our healthcare providers and local public health with the resources to manage outbreaks and issues locally. I want to be very clear that we are able to reopen like this because of the efficacy of the vaccines. For those of you who are vaccinated, you've helped us reach this point, and you are protected from this virus. However, there are still Oregonians who need to take extra precautions to feel safe and to stay safe. People battling cancer and immunocompromised Oregonians, to name a few. There are also many Oregon kids who are not yet eligible for a vaccine. So it's going to remain incredibly important for Oregonians to continue making smart choices and to respect the choices of others. Let's respect one another as we prepare to make this transition. If you see someone wearing a mask, or if someone asks for your cooperation to keep them safe from COVID-19, let's look out for each other. That means being cautious around kids and others who cannot yet be vaccinated. In addition, our communities of color continue to face certain barriers because of our healthcare system, like much of our society, still suffers from the impacts of systemic racism. Our BIPOC communities have not historically received the same kind of quality care as white communities. It is our job to break those barriers, and we still have lots of work to do on this front. When we cross the 70% threshold, it doesn't mean we are stopping our vaccine rollout. Quite the contrary. It means we have more hard work in front of us to vaccinate the next 10% and more of Oregonians. It means we must double down to keep reaching every community with information and vaccines. I wanted to take a moment this morning to lift up some of our community partners who have done tremendous work to vaccinate their residents. Benton County, for example, has already vaccinated over 50% of their 12 to 16-year-olds through early, effective, and creative outreach. Well done, Benton County. This past week, I visited the One Community Health Clinic in Hood River. They have extraordinary efforts underway to reach people face-to-face in their languages and in the field at their places of work with information and vaccines. And it's working. This is largely what the next phase of our vaccine rollout will look like. Meeting Oregonians where they are and working through primary care providers and local pharmacies to make sure that people have access to a vaccine. This has really become a tale of two pandemics. If you are vaccinated, then you're protected and you can carry on safely without wearing a mask and social distancing. However, if you are not vaccinated, this virus still poses a very real threat. I've invited Dr. Davion here today to share what he's seeing in the ICU in Bend. In short, it's pretty clear that the vast majority of patients now coming into hospitals with COVID-19 are unvaccinated. But before I turn it over to him, I wanted to remind everyone that our Take Your Shot Oregon campaign makes all vaccinated Oregonians eligible for $1 million and more. And while that drawing will be in the beginning of July, we have more surprises in the works that you'll hear about soon. So if you haven't yet been vaccinated, now is the time. You never know. You may just walk into a vaccine clinic or a pharmacy to get your vaccine and find out you're a winner. With that, I'm going to turn it over to Dr. Davion.
Thanks, Governor, and good morning. I've been asked to kind of speak to the perspective on the ground here. And I think it is very true that we're seeing a significant divergence in the experience of vaccinated versus the unvaccinated. The short story is the vaccinated population is staying out of the hospital, and the unvaccinated are really the only ones getting into the hospital. Our numbers really bear this out. I've asked our team this morning to kind of run the numbers again, and the latest data we have from this since March 1st, we've had 346 patients hospitalized for a COVID infection, and only 18 of those were not vaccinated. That's a 95% rate of unvaccinated patients showing up, need to be admitted. Even more impressive or concerning, depending on how you look at it, is we've had 98 deaths, unfortunately, in our hospital system. 97 of those were unvaccinated. So it's the numbers and our experience on the ground are bearing out the findings that vaccinations are incredibly effective, even better than we hoped for when we first started rolling them out. You know, here in Central Oregon, we have an amazing staff. We're really able to provide, top level care. We have really dedicated RNs, respiratory therapists, physical therapists, occupational therapists. We have all the tools in place to treat these patients as best they can be treated. We learned a lot about how to treat them over the past 12 months. We're definitely better at it than we were when we started. But it's still, every COVID admission is a really arduous journey for every patient. The length of stay is much higher for these patients. A patient ends up in the ICU, an average stay is 2 weeks, and often it's much longer than that. And we're seeing younger patients now, and this is probably because a lot of our older populations are protected now. So we're getting younger patients. We're seeing more virulent variants in this community. And, but it's not just about the numbers. We've had, very tragic cases that have been very trying for obviously the patients, their families, our staff. We had to move out a young person less than 40 years old to get ECMO therapy out of state because all of the ECMO beds in our state are taken up, and they had to be shipped out. There was another person that was otherwise healthy, in their 50s, very athletic, unvaccinated, unfortunately, really fought hard. Everyone really worked with him, tried to care for him as best we could, and we couldn't get him through. It was a very tragic situation. It's really tough to see, especially now. This is essentially a preventable disease for almost everyone, that we don't need to keep seeing this happen over and over again in our hospitals and ICUs. So that is really the message I would encourage all of our fellow Oregonians to take home from this.
Thank you, Dr. Davignon. We really appreciate you joining us and taking time out of your busy schedule today. With that, I'm going to turn it over to Director Pat Allen, the Oregon Health Authority.
Thank you, Governor Brown. Again, I'm Patrick Allen, Director of the Oregon Health Authority. This morning, I want to provide some updates and make a few observations as we enter the home stretch toward our goal of vaccinating 7 in 10 adult Oregonians. I'm joined today by Dr. Dean Seidlinger, who will share the latest data on COVID-19 infections and deaths among people who are vaccinated and unvaccinated in Oregon. As we begin the month of June, we're nearly 6 months into Oregon's COVID-19 vaccination drive. It's been close to 6 weeks since we expanded eligibility to all adults on April 19th. During these past few months, we've seen the virus come roaring back and then begin to retreat. In that time, a stark picture has emerged. There isn't one pandemic in Oregon, there are two. One is a pandemic that is dying out among people who are vaccinated, and the other is a pandemic that is raging as fiercely as ever among people who are unvaccinated. Yesterday, OHA doctors and epidemiologists posted our latest report on breakthrough cases among people who were vaccinated in May. It found that 98% of the 16,097 COVID-19 cases recorded in May were among people who were unvaccinated or not fully vaccinated. More than 9 in 10 COVID-19 deaths occurred among people who were unvaccinated or not fully vaccinated. I want to say that again. Last month, 16,097 people in Oregon caught COVID-19. 98% of those Oregonians were unvaccinated or not fully vaccinated. Among the 126 people who became severely ill and died of COVID-19 last month, more than 9 in 10 of those deaths occurred among people who were unvaccinated or not fully vaccinated. The data clearly show that if you are fully vaccinated, you can begin to put the pandemic behind you. You can have confidence that a get-together with friends, a family celebration at a restaurant, or a day at work alongside others won't put you at high risk to contract or pass COVID-19. You have the peace of mind to know that if you have close contact with someone who is infected, you won't have to worry about quarantining yourself for an extended period. But if you're unvaccinated, the threat of COVID-19 still shadows your life. Just as in the darkest days of last spring, last fall, or earlier this winter, you're vulnerable to getting sick or worse, becoming seriously ill yourself, or passing the virus to someone who might wind up in the hospital or dying. As a result, if you become in close contact with a person who's infected with COVID-19, you'll need to quarantine for a period of time. You can see the same dynamic playing out at the county level. Over the past month, most counties with high vaccination rates amongst adults also tend to have lower than median infection rates. Those counties include most counties that have topped the 65% threshold to move to low risk or are close to it, such as Benton, Clatsop, Hood River, Lane, Lincoln, Multnomah, Tillamook, and Washington counties, which all have vaccination rates over 60%. Conversely, Crook, Klamath, and Harney counties have lower than median vaccination rates, but significantly higher than median case rates over the past 30 days. Dr. Seidlinger will provide more details in a moment, but it's clear that people who are getting COVID-19 are Brown's goal to vaccinate 70% of adults in Oregon. If I could go to a slide, please. We're closing in. As of yesterday, more than 2.2 million Oregonians have received at least one dose of a COVID-19 vaccine. According to the CDC, Oregon has vaccinated 66.2% of adults, 2,217,841 people who are 18 or older. That means, as the governor said, we have to vaccinate approximately 127,000 more adults to reach our goal. Oregon ranks 18th in the nation in total population who've received at least one dose. According to the CDC, 55% of all Oregonians have had at least one vaccination. The national average is 51%. However, it's clear we did hit a speed bump over the Memorial Day weekend. Our daily average doses delivered dropped to 17,551 after some quiet days over the holiday. While the pace began to pick up over the week, it'll be a couple of more days before all the data comes in and we can see if the numbers were a holiday anomaly or the emergence of a new trend. But as this slide shows, we're still tracking at a level above our worst case scenario, which would have us reaching 70% by June 21st, the first day of summer. I'm also encouraged to report that our partnerships with federally qualified health centers, community-based organizations, and local public health departments are closing the vaccination gap between whites and communities of color. Over the past week, vaccinations among Latinos and Latinas increased 5%. Vaccinations among Black Oregonians increased 5.4%. Vaccinations among American Indian and Alaska Native Oregonians increased 5.2%. Vaccinations among Native Hawaiian Pacific Islander communities increased 5%, while vaccinations among white Oregonians increased 2.5%. Finally, beyond the incentives Governor Brown has announced and the many local partnerships we're pursuing to stage vaccination clinics in communities across Oregon, we see partners continuing to step up to vaccinate Oregonians. This month, Safeway Albertsons, CVS, Walgreens, and Rite Aid pharmacies are all extending their hours to give more people a chance to get vaccinated. For example, Rite Aid will offer COVID vaccines on 3 Friday nights, June 11th, the 18th, and the 25th until midnight. We know many people who haven't chosen to get vaccinated yet aren't vaccine resistant, just vaccine inconvenient. They have little time outside the demands of family, multiple jobs, or other commitments. We appreciate our pharmacy partners extending hours so more people like that can get in and get vaccinated. Now let me turn it over to Dr. Seidlinger to talk more about why it's so important to get vaccinated.
Thank you, Director Allen. As I usually begin my comments, I start with an overview of the state of pandemic in Oregon. But this week, I want to further the profile of the two pandemics that Governor Brown and Director Allen alluded to earlier. In one pandemic, as we near the threshold of 70% of adult Oregonians getting at least one dose of the COVID-19 vaccine, spread of the virus is clearly waning. Daily cases and COVID-19 hospitalizations and the percentage of people testing positive are in steady decline since the most recent surge gripped us 6 weeks ago. Over the past week, we've seen a 13% drop in newly reported cases each day, marking the 5th consecutive week cases have fallen. On June 1st, our 7-day moving average for daily cases is 318, which is 61% lower than it was on May 1st. Similarly, the weekly rate of positive tests for COVID-19 has fallen dramatically from 6.9% on May 1st to 4.3% on June 1st. COVID-19 related hospitalizations are following a similar trajectory. Recent hospitalizations have declined 11% and 24% during the past 2 weeks. And since May 1st, there are 31% fewer people infected with COVID-19 in our hospitals. Serious COVID-19 illness is also on the downswing. On May 1st, there were 71 COVID-19 patients in intensive care units across Oregon. Today, there are 57. This is freeing up more of these critically needed beds for others who may be in need of specialized medical care. COVID-19 deaths are a lagging indicator, and they increased according to our most recent COVID-19 weekly report from 34 to 50 last week. This is reflective of our recent surge in cases, which is now decreasing. Every death from COVID-19 is tragic and is one too many. My thoughts go out to everyone who has lost a loved one to this virus. Oregon has consistently ranked near the bottom among states in COVID-19 related deaths when we look throughout the pandemic, meaning more Oregonians are with us today because of the actions we've taken. We are also seeing counties move into lower risk categories based on decreasing cases and the percentage of populations vaccinated. This has resulted in lifting of restrictions, allowing more of us to gather and return to the activities we enjoy, with friends and families that we've all missed. Several times during this pandemic, Oregonians have stepped up to turn back a resurgent tide. Thank you for that. During most of this pandemic, the only effective tools for keeping the virus at bay were keeping our distance, limiting our gatherings, wearing masks, and washing our hands. But now we also possess the ultimate tool for crushing the virus: widespread access to safe and effective vaccines. The actions you've taken throughout these past 18 months have saved lives and have spared Oregon from many of the worst outcomes experienced in several other states. That's a testament to your collective efforts to stem the tide of the virus. Thank you. And that brings us to the other pandemic profile, the one in which the shape-shifting virus now rages, resulting in comparable impacts to what was experienced during the darkest days of the pandemic among those who have not yet been vaccinated. Our data in Oregon supports what we've observed in the science. People who are vaccinated against COVID-19 are at an extremely low risk for serious illness or death associated with this virus. Let's look at the data that shows the stark contrast between the two COVID-19 environments since vaccinations accelerated about 3 months ago. This slide shows COVID-19 cases and deaths between fully vaccinated and unvaccinated people between March 1st and May 31st of this year. A staggering 98% of COVID-19 cases were in people who were either not vaccinated or not yet fully vaccinated. An astonishing 94% of COVID-19 associated deaths were among the unvaccinated. The overwhelming number of deaths among vaccinated people, as reflected in this chart, were elderly Oregonians, many in long-term care facilities, and many with severely compromised immune systems. Again, my thoughts go out to every Oregonian's family and loved ones that we've lost to this virus. Overall, counties that fared better in vaccinating their populations had lower case rates in comparison to counties that have lagged. These include some of Oregon's most populous counties. Vaccinations are making a difference across Oregon. Our data shows that difference starkly among older Oregonians as vaccination rates rose in the population. We saw a sharp upward trajectory in vaccination rates as vaccinators reached most older Oregonians. At the same time, cases decreased, with only small increases during our recent surge in cases across Oregon. This next slide shows a similar, though less dramatic trend is seen when we look across all adults, that we haven't reached the same level of success yet with vaccination rates. The decision to get vaccinated is a very personal one, but the data unquestionably shows that the widespread availability of safe and highly effective vaccines has flipped the script in Oregon. We can now determine whether to protect ourselves, our families, our loved ones in our communities by getting vaccinated. For those who are vaccinated or in the process of completing your vaccination series, thank you. For those eligible who aren't yet vaccinated, I urge you to step up, make a plan, and get vaccinated. We are not free of the ravages of COVID-19 just yet, but by vaccinating more Oregonians, we can speed up a return to normal life. Oregonians have sacrificed and suffered for 18 months. Take that final step, get vaccinated, and a return to normal life is finally, at long last, within our reach. And with that, I'll turn things over to Governor Brown.
Thank you, Dr. Seidlinger. Charles, we're ready for questions.
Thank you, Governor. We'll start with Lincoln Graves from K2. Go ahead, Lincoln.
Governor Brown, thank you for taking my question. I wanted to ask you about Republican State Senator Kim Thatcher. She introduced what she calls civil rights legislation to ban vaccine passports in Oregon, basically saying, she's quoted as saying, the governor's vaccine passport scheme is an extreme invasion of Oregonians' privacy. What's your response to that?
Look, we provided a system to allow businesses across Oregon to make a decision about whether to require masks or to verify vaccines based on their business model, based on what meets the needs of their customers, their clients, and their staff. the business community has been an extraordinary partner throughout all of this effort, and I really appreciate their efforts. My focus right now is getting to 70%. We have 127,000 Oregonians that we need to get vaccinated so we can fully reopen the economy, and that's where I'm focused.
One follow-up for you. During the pandemic, of course, so many of us were asked about whether we were sick, whether we've been exposed to COVID-19, and obviously that's sort of an honor system type question. I know we're close to 70%. Why can't vaccine verification, why can't that be on an honor system right now?
Look, as I said, we gave businesses a choice, and businesses can make a decision about what works best for their business model. We're talking about a very short period of time and literally 127,000 Oregonians to get vaccinated. So I am focused there. I am continuing to work with our business partners, with our other community partners, so that we can get as many shots in the arms of Oregonians as quickly as possible so that we can fully reopen the economy. We're talking 127,000 vaccines to fully reopen. I think we can all look forward to that.
And this is my final question. I wanted to ask you, you talked about business partners. Do you feel you have the support of the business community in Oregon in regards to asking?
Throughout the pandemic, the business community has been a tremendous partner in this effort. They have taken extraordinary steps to keep their employees safe, to keep their customers and clients safe. And frankly, it's one of the reasons that Oregon continues to have, throughout the pandemic, one of the lowest infection rates and one of the lowest mortality rates in the country. That would not have happened without our partners in the business community.
Thank you, Governor Brown.
Thank you, Lincoln. We'll go next to Lisa Balick with COIN. Go ahead, Lisa. Lisa, are you there?
Yes, I am.
Go ahead.
Yes, thank you. Governor, what's the data showing whether the prize system, the lottery for getting a shot, is having an effect?
That's a really good question, Lisa. The good news is that Oregonians have done a really fine job getting vaccinated, and we're doing really well. What the data is showing regarding our Take Your Shot campaign is that we are seeing some communities in rural Oregon showing a slight uptick in terms of vaccination and rates. And obviously, some of these communities are some of our most challenging communities in terms of vaccination uptake. So that's a good thing. We're also looking at partnerships with counties across the state to see what other tools they can use to incent and motivate more Oregonians to get that first shot in their arms.
Are there plans to partner with restaurants, for example, to give out certificates and that money backfilled to the restaurants from COVID dollars?
We have partnered with a number of folks, including our trailblazers. Director Allen, can you speak specifically to restaurants?
Governor, I can't speak specifically to restaurants, but we are fielding any number of proposals and ideas that are coming in, looking for ways to leverage the investment in the cash prizes and scholarships, and we'll continue to explore those and roll them out as we can.
And Lisa, as I mentioned in my remarks, we've got a few surprises we're working on, so stay tuned.
Thanks, Lisa. We'll go next to Aaron Ross with OPB. Go ahead, Aaron.
Good morning. I am curious about the decision to remove masks entirely once we go into full reopening. Right now, we have a number of counties that have very low vaccination rates, as you have seen, or as you've mentioned, in very high rates of transmission. And at the same time, we are also seeing, we also know that cases are, or that that COVID is spreading just as fast among unvaccinated folks as it was prior to vaccines being rolled out. So how are you going to protect those unvaccinated folks? Cases are declining, but it's clearly not actually impacting the rate of transmission. What will those people do once all of the masks are gone? What will kids do?
Well, I was very clear in my remarks that we will continue to follow federal guidelines in terms of masking once we reopen. And that may include masks at health clinics. It may include masks in airports and on public transit. So we're obviously waiting for updated information from our federal partners. In terms of communities where there are low vaccination rates, I'm obviously very concerned. These communities tend to be very medically and economically vulnerable. And Dr. Davignon very clearly articulated the impacts of COVID on folks who are not vaccinated. So I continue to remain concerned. And that's why I am asking Oregonians to remain respectful, even as we transition to fully reopening, to remain respectful of your fellow Oregonians and their choices to wear masks or not, to protect other vulnerable Oregonians, including folks who are immunocompromised and children, for example. Dr. Seidlinger, you want to jump in here?
Thank you, Governor Brown. I think as we move forward and we hit that target of 70% of individuals who received at least one dose of vaccine, we will have significant protection across the state. That doesn't mean that every community and every individual is protected. So for individuals, I urge you to get a vaccine. It offers protection to you and to those around you who either can't get a vaccine, as Governor Brown mentioned, the children under 12, or for those who are around you who are immunocompromised, where the vaccine may not work that well. Certainly, if you're unvaccinated and in a community where COVID-19 rates are higher, you are at an increased risk for getting COVID-19. So taking some individual steps to protect yourself, continuing to wear your mask and limit your gathering are choices you can make to be safe. But another choice you can make is to have a discussion with your doctor or healthcare provider to talk about getting the vaccine, because that does offer the best protection. So as we move forward, individuals need to work together. The steps you take protect yourself as well as the loved ones around you. And so we're in this together. We have been since the start. And that's the way we're going to come out of this into a summer filled with those 4th of July barbecues you heard about, our summer festivals, getting our children back into school, and getting back into a more normal routine that we had before this virus came into Oregon.
But my understanding is that this 70% for adults numbers is based on this idea of reaching protective herd immunity. But of course, 70% of adults is far from 70% of the state. And as we can see in counties like Deschutes County, where Dr. Avignon is located, that we can have extremely high vaccination rates and still fill every ICU bed in the region. So it seems to me as though this pandemic is far from over, even in areas that do have very high vaccination rates. So should people in that community, will kids just not go to grocery stores? Will we just not have people of color who aren't vaccinated yet go shopping? What should they do?
Let me start with some comments, and then I think Director Allen can fill some in. Certainly 70% is not the end. Receiving at least one dose of vaccine. That's more individuals who have protection, more individuals who are protected themselves and are protecting those around them. So we can start to see loosening of these restrictions, capacity limits going away. That doesn't mean individuals who aren't vaccinated, who are still at risk for disease, because they're immunocompromised or because they're younger children, may not need to take additional precautions. And then that doesn't mean that our work at the Oregon Health Authority, our local public health partners, community-based organizations, healthcare partners, almost everyone in the state still has to get vaccines into arms of additional people. We don't end at 70%, but it begins the next stage of our fight against this virus. Director Allen?
I was just going to comment that as we cross that 70% threshold, I think what we begin to do is move out of the crisis stage that we've been in statewide with the coronavirus pandemic, and we move back to the system that already existed for how to manage communicable disease across the state. And that's really a local system with the local health board, which is the county board of county commissioners, and the local health department managing outbreaks of disease as they have for years and years with influenza and other serious diseases that also result in hospitalizations and deaths. And believe me, these counties are eager to take that responsibility and manage those outbreaks at the local level using the tools that they think best. And I think that's the system we move back to at that stage.
Thank you.
Thank you, Aaron. We'll go next to Gary Warner with EO Media. Go ahead, Gary.
Hi, thank you very much for taking my question. I wanted to find out about the situation involving variants. In the United Kingdom on Tuesday, they reported the first day without any deaths since last June. But the government also said that they were experiencing a new wave of infections due to a highly virulent variant out of India. We've talked all along about how there are different versions of this virus. How are the steps that you're taking today going to be pulled back, or there'll be warnings put out if these virulent viruses start to spread across Oregon?
So, Gary, as we've mentioned, the best protection that a person can have against the variants, against the virus, is a vaccination. It's the best way to protect yourself and your loved ones and to prevent hospitalizations and deaths. As we move to reopening, the pandemic response will move to the local level and local elected officials to make decisions based on what's happening on the ground. Dr. Seidlinger, Director Allen, do you want to add some more information there?
Thank you, Governor Brown, and thank you, Gary, for that question. Oregon has not been immune to the impacts of variants of concern and variants of interest. We've seen, the alphabet soup variants come into Oregon from B117, which transmits much more easily and leads to potentially more serious disease, to other variants that are less impacted by the vaccine, cause serious disease, and also transmit more easily. These variants in Oregon likely contributed to the surge in cases we saw over the last several weeks, and they continue to be a part of our fight here in Oregon. But we know that those vaccines, while they may be less effective against some of the variants, are still effective against those variants and are effective at preventing the serious complications that result in hospitalizations and cutting down on the risk of death from this, regardless of the variant that you have. But we know as the disease continues to spread, whether in Oregon, other states, or other countries, that potentially more dangerous variants could emerge. And that's why it's really important that individuals get their vaccination. That protects themselves and those around them, prevents the disease from continuing to spread, continuing to mutate and cause more variants that could lead to an ongoing fight against this virus that lasts far longer than we'd like. It could also lead to more serious cases, but vaccination will protect you. Vaccination will protect those around you. Continuing to wear a mask or keep your distance and limit your gathering if you can't be vaccinated or immunocompromised or otherwise worried and you're in a community where the virus is raging and variants are raging. These are the steps that protect us against all these variants, and working together, we can limit the spread in Oregon, limit the spread of variants, and get back to a more normal life that we saw before COVID-19 ravaged Oregon, the rest of the country, and the rest of the world.
Okay, one quick follow-up for Governor Brown. If we get to 70% around June 21st, that pretty much lines up, I believe, with your last extension of your emergency order. How would getting to 70% affect the emergency order situation?
Well, we're certainly exploring the legal ramifications, and we'll be making a decision closer to that time frame. But what I will say is this: as we move from a response into recovery, we may need tools like continued state and federal resources to help with recovery efforts. Obviously, the pandemic will not be over when we reach that time point, and we will need to continue to collaborate, partner with our federal partners and local community partners to continue our vaccination efforts and to keep up our efforts to keep vulnerable community members safe.
Thank you.
Thank you, Gary. We'll go next to Pat Duras with KJW. Go ahead, Pat.
Thank you. First, Governor, thank you for the numbers as how far we have left to go. I think that is helpful. But I was wondering if we could pivot for a moment and talk about the Klamath Basin. As I'm sure you're aware, there's growing tensions down there. The federal government has cut off water to the farmers from Klamath Lake because of the drought. The farmers are saying that if the water is not restored, they'll go in and start the water flowing themselves. So what are your concerns there, and what, if anything, can you do to help the situation?
So my heart goes out to the people of the Klamath Basin. The region is suffering from a tremendous drought this year. It is extremely challenging, and I am working with our local and federal partners to make sure that the region has the resources it needs in terms of this effort. I've had an opportunity to talk with Secretary Holland multiple times about this, as well as local elected officials. I think everyone is focused on making sure that people stay calm throughout this process, and that we get any additional financial resources to the region as quickly as possible. I will say this, Pat, I was there in 2001. When I was a member of the legislature, I went down with my legislative colleagues to watch the bucket brigade. These are incredibly challenging circumstances. It's challenging for the farmers. It's challenging for the tribes in the region. It's extremely challenging. I want to encourage everyone to keep their efforts peaceful and to let them know that we are doing everything and we can to get resources there to assist.
Okay, thank you.
Thank you, Pat. We'll go next to Simon Gutierrez with KPTV. Go ahead, Simon.
Hi there. Thanks for taking the question. This is directed at Pat Allen, but I would love for the governor to weigh in if she could. You mentioned June 21st as being a target date. What the modeling suggests that we'll reach that 70% threshold. You make that sound like a slam dunk, but do the numbers back that up? Is it pretty clear that the rates are going to continue at such a pace that we're going to reach that mark on or around that date?
Simon, I will just say this is truly an all hands on deck effort. We're working with elected officials across the state to continue to enhance our communication and education and information efforts to encourage Oregonians to get vaccinated. We're looking at surprise incentives to coax a few more Oregonians to get a shot in their arm. And we're doing everything we can to meet those timelines. Director Allen?
Yeah, I would not characterize this as a slam dunk, and if I have, I've certainly misspoken. It's going to take everything, all the things the governor outlined, and a lot of people working really hard to get us those doses per day that will get us to 70%. That June 21st date is what our model calls for if we had a 50% reduction in where we were, I think, about 2 weeks ago. And we're kind of trending toward that line now. Partly that's an effect of the big drop off we had in doses over the Memorial Day weekend. We don't have any more holiday weekends coming, and so we shouldn't have that effect again. So I think we are going to make the governor's June 30th target, if not the June 21st target that was modeled back a couple of weeks ago. But it's going to take a lot of hard work by a lot of folks to get there.
And just one quick follow-up, Mr. Allen, if you're mentioning the BIPOC communities and some increases in rates of vaccination there, do we have the infrastructure and resources going in the right directions to keep those numbers where they are, or preferably increase them up to a little higher?
Yeah, I'm actually very happy with the investments that we've made and the results that they're yielding. If you go back to April 1st, for instance, in the Latina community, they were getting vaccinated at about 1/3 the rate of the state average, and today that's up over almost to 2/3 of the state average. So we've closed that gap quite a bit. We have a lot of work yet to do, but we now have in place mobile vaccine efforts. outreach efforts and education, community-based vaccination events, a whole bunch of things that are what is causing the vaccination rate right now to be basically double in communities of color than it is in the white population.
And just really quickly, we mentioned primary care providers and having supplies of vaccine for people that way. Are we there right now? Do they have that available to give to their patients? And also, are you going to be working with businesses to do in-house vaccinations?
Yeah, so right now we have vaccine on hand in primary care settings. I wouldn't say we're quite to every single primary care provider having it yet, but we're building toward that. That becomes more possible as the mass vaccination sites begin to wind down, which they are now doing. We do have examples of various kinds of business vaccination events that have occurred and continue to be ready to support businesses that want to do that. Farms is a great example. We've done a number of vaccination events at farms with migrant seasonal farm workers and other agricultural employees as a way to contribute to that increase in BIPOC vaccinations.
Thank you very much.
Thank you, Simon. Thank you, Simon. We have time for just 2 more questions, so we'll go next to Amy Green with the Oregonian. Go ahead, Amy. Amy, are you there? We'll come back to Amy. We'll go next to Jenna King with KOBI. Go ahead, Jenna.
Can you hear me?
We can hear you, Jenna.
Yes, go ahead.
Awesome. Governor Brown, thank you for taking my question. We understand that Josephine County commissioners have written you a letter demanding that Oregon public schools do not require students to be vaccinated this next school year. I want to know what your reaction to that is, and is that something you or state officials are considering?
Well, I will just say this. At this point in time, children under 12 are not eligible for the vaccine. So that obviously is not a possibility there. Look, I want to encourage parents across the state to do what's best for their children. We are seeing incredible vaccination rates for children 12 and older. And as I mentioned, Benton County is just knocking it out of the ballpark with their creative, effective outreach efforts. They have 50% of their kids vaccinated between the ages of 12 and 17, which is really, really remarkable. We're going to continue with these educational and informational efforts. At this point in time, as you know, the vaccine is not fully authorized. We are working under an emergency use authorization. And so we have no plans to move forward. Director Allen.
Yeah, I can add just quickly to that. First, to reinforce what you said, Governor Brown, about vaccination so far, Oregon is in the top 10 of states for 12 to 15-year-old vaccinations, which is great news. But as the governor indicated, the vaccines are not yet fully approved. The Advisory Committee on Immunization Practices has not taken up the issue of as it usually does, to advise on school vaccinations. As a result, we in Oregon have not taken up that issue either, and I don't anticipate that discussion occurring anytime soon, and certainly not before there are vaccines available for younger kids and before they're fully approved.
Thank you. Governor Brown, just one more thing. Can you just reiterate maybe what your message is to those commissioners?
It's time to take your shot. If you haven't gotten one, this is an incredible opportunity. You have the chance of winning $1 million. You have a chance of winning $10,000 at the county level. I want to encourage them to partner with all of us to get Oregonians vaccinated, to protect yourself and your loved ones, and to prevent hospitalizations and deaths.
Thank you.
Thank you, Jenna. We'll go back to Amy now. Amy, are you there?
Can you hear me now?
Yes, there's a little bit of an echo.
Okay, is it better now?
Yes.
Go ahead.
Hello. Great. Didn't work.
Yeah, we hear you.
Yes. No.
Okay, can you hear me now?
We can hear you.
Go ahead.
Hello. No.
Yes,
Amy,
we can
you
hear
hear
you.
us?
Can you hear me now?
Yep. I mean, if you want to follow up with us after the press conference, can you hear? Try one more time. All right. Thanks, Amy. I think that's all the time we have for questions now, Governor.
All right. Thank you so much. Be safe out there. And if you haven't gotten vaccinated yet, please step up. Help us fully reopen Oregon in the next few weeks. We just need 127,000 Oregonians to take your shot.